Hi, welcome to the Health Corner on the Breakfast Show. I am Dr. Nakuya Namfaya. This week we are talking about hypertension, and yesterday we talked about what hypertension is and how it comes about. We say that hypertension is an elevated blood pressure or high blood pressure of 140 and above, 140 over 90 and above. So we also say that hypertension has got many causes, and most of the people that have hypertension don't even know that they have hypertension. And most of the people who have hypertension, their cause is usually not known. But there are other conditions that can cause you to have hypertension. Diseases like diabetes and kidney disease. These conditions can make you to have high blood pressure. So today we'll be talking about some of the signs and symptoms of hypertension. So hypertension doesn't usually present with any signs or any symptoms. Usually patients who have hypertension will not even know that they have hypertension or high blood pressure. And they will only be able to know that when they get tested at the hospital or their blood pressure is checked at the hospital, and then they find out that they have hypertension. But there are some people that might have symptoms like headache, which are non-specific. So they might have headache, some might have bleeding from the nose, some might be feeling dizzy very often, lightheaded, and shortness of breath. So these are just some of the symptoms that people with hypertension might present with, but they are not specific to hypertension. And so people might not know that it's actually high blood pressure that is causing them to have these headaches or these nosebleeds. So it's important that you get checked if you have any of these symptoms. Also, people with hypertension might present quite late at the hospital. And so they might present when the hypertension or the high blood pressure has become so high and has caused injury or damage to another organ in the body. And so many organs can be affected in the body. These include the heart, the eyes, the kidneys. And so if one of the organs has been affected and you start experiencing symptoms based on that particular organ. So for example, if you have you end up having a heart condition because of hypertension, you might present with chest pain and shortness of breath, dizziness. If you have problems with your eyes, you might present with having problems with your eyes, not knowing that it's actually the hypertension that is causing those problems. So it's important that you check your blood pressure on a regular basis for you to be able to know if your blood pressure is in the normal range. So these are just some of the symptoms of hypertension. So today we are learning that hypertension can present with symptoms of headache, bleeding from the nose, dizziness, and shortness of breath. And sometimes it can affect certain organs in the body, and you end up having symptoms based on the organ that is affected. So if it's the heart, you can end up having symptoms of chest pain. If it's the kidneys, you can end up having symptoms of kidney problems. So it's important that you check your blood pressure and know what your blood pressure is. So this is all for today. I do hope you'll be able to watch again tomorrow at the same time on the Breakfast Show here on Camden TV. Thank you for watching.